The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
The state health department, they're saying 57 people have died from influenza-related illnesses this year. Can you believe it? 41 of those were actually people 65 or older, one of our more vulnerable populations there. Now, the CDC is saying that nationally there have been at least 24 million flu illnesses, diagnoses, over 300,000 hospitalizations, and 13,000 deaths there. Now we have Wish TV medical expert Dr. Janelle Gordon here to break down all this information and to tell you how long flu season could last, the treatments and preventions that you need to take care of yourself and your family. Dr. J, thank you for stopping by.
Thank you for having me. Good morning, Jeremy.
Of course. Good morning to you. I hate that we're on such a solemn topic, but it is such an important one. When you're talking about the flu, when you're talking about colds, people don't really take it seriously because it's something we encounter all the time, but it can get serious.
It can get very serious. And actually this year, we're hearing that this is the most intense flu season that we've had since the 2009-2010 season, when we actually had a pandemic of swine flu hit the nation.
Now you have the numbers for all of this. You're saying right now that this is comparing not in a good direction when it comes to the previous season.
No, it's not. And individuals always wonder, well, how long is this going to last, like you ask? And so typically flu season will run from late fall to early spring, and it peaks around this time of year in the month of February. So if individuals have not received their flu vaccine, it is recommended for individuals 6 months and older to go ahead and get that now.
Now let's talk rates. When we're talking about how high they are compared to this time last year, what are we looking out for? And if you have the exact kind of areas when we're talking about the Midwest specifically, where do we stand with the rest of the country?
Sure. So like you said, we get the flu every year. It hits the nation, and individuals always wonder, well, how are we doing in our neck of the woods? So what we do know is that 43 states across the nation are saying they have very high, or at least high, cases of flu. However, the South, Southwest, and Western states have been hit the hardest. There was actually a school district in Texas that had to shut down for 3 days because they had 650 students and 50 faculty members out, or staff members out.
Now, how long do you think this is going to last this year? It seems like we're going for a longer stretch just because our weather patterns have really been influencing that just a tad.
So sometimes you can get flu cases even outside of the typical season, but usually around April we'll see those numbers start to die down.
Now, when it comes to the treatments that are available, I mean, I always know the doctors ask me every time I go, hey, do you want your flu shot? Now, this year, with the numbers we've been seeing, I usually don't get one. So I know what you're thinking, Jeremy. Get on it. I did this year. I went ahead and told them I want my flu shot.
Well, you're not alone in that, because oftentimes patients will say, well, how good is the flu vaccine this year? And we actually aren't fully aware. As we know, there has been a presidential pause on health communications coming from federal health agencies. However, I still do recommend that individuals get it. And people will say, well, I got the flu last time I got the vaccine, so it didn't help me anyway. It does help decrease the severity of symptoms that you could experience and even possible complications, hopefully even decrease the duration that you'll feel sick if you do catch the flu.
As we start to wrap things up, let's talk prevention. Of course, hand washing is the big one. If you look over there on the desk, I've got my hand sanitizer, and Scott can tell you I'm wiping down the laptops. Phil Sanchez wiped down desk. I'm telling you, what else can we do other than just keeping cleanliness next to godliness?
Exactly. So number one, we do want to make sure that individuals 6 months and older are getting their flu vaccine. If you are concerned about possible allergies to active ingredients, please speak with your primary health care team, or at least speak with your local health department. Schedule a visit to get that done. Make sure that if you are sick that you're staying home. Distance yourself from individuals who are sick. Make sure we're getting restful sleep, keeping our stress levels low, staying physically active, and eating nutritious foods, especially those whole fruits and vegetables, whole grains that are going to be full of antioxidants, which can help build up our immune system and hopefully prevent us from catching flu this season. For more information, viewers can check my article at wishtv.com later today.
Wonderful. Well, Dr. J, it's always so helpful to have you on hand. It's like having the doctor without the bill.
Exactly.
And the time to go out and get the checkup. So thank you.
Yes, thank you, Jeremy.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV.
Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now.
Now at allindianapodcastnetwork.com.